Right now, construction is underway at the former downtown Minneapolis YWCA building. A project is underway to expand a resource for kids in need of care and support. To tell us more about what we can expect, we're talking with the CEO of St. David's Developmental and Therapeutic Services, Julie Shortall. Thanks for being here.
Thanks for having me. I'm honored.
So for viewers who don't know about St. David's, tell us about who you serve and why the services are so important.
Absolutely. So St. David's has been known as a trusted leader for 65 years,
Wow.
providing services to critically needed services to thousands of children and families across the community. We are known for our expertise in supporting children with complex developmental and behavioral health needs. And what sets us apart is both our proven solutions and our expertise in early, intensive, and multidisciplinary care. So we are working with kids. We meet children at a critical stage of development, and we provide the right therapies at the right time, and we see really meaningful and lasting change in their developmental trajectories.
Very important work. Decades of experience coming to a pretty central area. I mean, you chose downtown. You just had a groundbreaking at Nicollet Center, right? Why was downtown the right place for this expansion?
Well, a couple of things. The first thing I'd say is that 2,000 children have been on our wait list for years. Even though we have children coming and going into services, we just have retained a very high wait list. But the second thing is accessibility. Children shouldn't have to wait for services, and they should be accessible. So to have a site right in downtown Minneapolis that's accessible to both St. Paul and Minneapolis, and easy to get to and on public transportation, that was a critical reason for a downtown location.
Very smart. Another area for folks to get the help that they need. So you're still building, but when folks do finally walk into this space, what can they expect?
So they can expect to see this, the YWCA was in the building. They still have their childcare there, so that will we are still renting space back to them for their childcare, but they'll see an old fitness center really turned into a comprehensive children's building where a range of assessment to intensive therapies are provided. So pediatric occupational and speech therapy, mental health, intensive day treatment, and then support services for parents and kids.
I'm sure it'll be unrecognizable when they finally do walk in, but yeah. I'm sure a peaceful and helpful space. What difference do you hope this new center will make for children and families in that community?
Our hope is that children have access to care, that children don't linger on wait lists across the community when early intervention can make all the difference in the world. As a result of the full renovation of the project of the building, we'll serve 2,000 children and parents annually. And so just to be able to have this beautiful range of services and have access and serve that many more children, that's meaningful.
It really is. And you did mention 2,000 kiddos on the wait list. This new building's kind of helping with that need.
It really
which is amazing. So I do know you mentioned that you're already providing some services, but before I let you go, can you walk us through when all families will be able to experience the building?
Yeah, so because of the urgent need, we tried to co-op space as much as we could. Two yoga studios became occupational therapy gyms right away, but now we'll renovate the whole first floor, and lots more services will be available in the building, and we'll be done with our renovation. We started end of June. We'll be done after the first quarter in 2027, so really launching our full range of services spring of 2027.
In a few months. All right, Julie, thank you so much for previewing this space and showing us where you're helping with gaps in the community. We'll have more details about this at care11.com/noon. We'll be right back.